Hello, my name is Juan Felix. I'm professor of pathology and obstetrics and gynecology at the Keck School of Medicine, and I practice at the Los Angeles County Women's and Children's Hospital. I'd like to talk to you today about a new product that is, in my opinion, very revolutionary. The product is the SpiraBrush biopsy brush. SpiraBrush was designed in an effort to create a biopsy device that would obtain diagnostic material from the cervix of patients while causing the least discomfort and blood loss from these patients. The design is rather simple, yet very efficient. It is a spiral brush that fits flushly against the cervix, and when rotated, removes the epithelium from the cervix. When the brush is targeted towards a lesion, the brush preferentially removes lesional tissue, which usually contains fewer adhesion molecules and comes off rather easily. The result is that the sample usually contains very diagnostic material, and in fact, in our clinical study, the SpiraBrush outperformed the punch biopsy when compared to the final LEAP sample. Although both groups were not statistically different, the SpiraBrush did detect quite a few lesions that the punch biopsy did not. Clearly, the FDA has determined that the SpiraBrush is equivalent to the punch biopsy in obtaining a diagnostic sample from the cervix to diagnose cervical cancer precursor lesions. Some of the advantages of the SpiraBrush over the punch biopsy can provide the clinician and the patient with some true and very valuable advantages. For example, a punch biopsy will result inevitably in some bleeding, and in some instances the bleeding can be quite significant, and it is time-consuming to obtain hemostasis from these lesions, and also it's quite unpleasant for the patient to remain in stirrups with the speculum in for the time while you're trying to stop the bleeding. The SpiraBrush instrument leaves virtually no bleeding, and it is extremely rare to need any hemostasis whatsoever. In fact, most clinicians who have switched over to the SpiraBrush have pretty much discarded their Moncel solution or their silver nitrate sticks because it virtually leaves only some minor beading of blood over the cervical erosion area. One of the other advantages which you will clearly experience is the advantage that the patient feels minimal discomfort during the procedure. Unlike a cervical biopsy, which will result clearly in pain to many of the patients who are biopsied, the SpiraBrush sample feels, in the description of most patients, like having a pap smear taken, not like having a biopsy. In fact, most patients are unaware that the biopsy is being taken at all. The SpiraBrush is placed against the cervix, and even when rotated fairly vigorously by the clinician, really causes no pain because it does not produce the pinching or the slicing or cutting that occurs with a punch biopsy. The effects are easily noticed even the first time the clinician uses the SpiraBrush. The SpiraBrush is meant to replace the punch biopsy for cervical sampling. It is been FDA approved as an equivalent to the punch biopsy, and the clinicians should use it exactly as they would use a punch biopsy of the cervix. So when the patient comes in with an abnormal pap, the clinician should schedule the patient for colposcopy, apply the acetic acid, and if a lesion is visible, sample that area of the cervix, the same area that the clinician would sample with the punch biopsy. The clinician should sample it with a SpiraBrush, so it is in place of the punch biopsy. Because it is in the place of the punch biopsy, it replaces the punch biopsies of the cervix and does not replace, for example, endocervical sampling that occurs with a curette. So if a patient does need endocervical sampling, the patient should receive an endocervical curetting or an endocervical sampling using a brush device that normally is used by the clinician. The SpiraBrush is not meant to sample the endocervix as an endocervical sampler or an endocervical curette. It is only meant to sample the cervix. As with the punch biopsy, You can prepare the cervix for examination with either acetic acid and perform colposcopy, or you can put Lugol's on the cervix in case Lugol's staining is necessary, and still be able to use the SpiraBrush for sampling. It is equivalent to the cervical punch biopsy, and anything that you do in preparation for the punch biopsy, you can do with the SpiraBrush. In addition, if the patient is in her menses and you feel that you would be able to take a punch biopsy specimen, you should be able to also obtain a sample using the SpiraBrush. Remember that the SpiraBrush removes layers of epithelium, not just cells, and that these samples will be placed as a biopsy specimen so that the blood from menses does not interfere with the ability of the pathologist to read the sample. Similarly, if your patient is pregnant, the same guidelines that can be utilized with a cervical punch biopsy can be utilized with a SpiraBrush sampler. So a patient who is pregnant who has an abnormal pap should go to colposcopy, and if indicated by the current guidelines that she should receive a biopsy, she can in fact be sampled with a cervical SpiraBrush sampler. Even though you rarely get significant bleeding with the SpiraBrush, every once in a while you will get some beading or spotting that will pool a little bit. You can in fact use Moncell's or silver nitrate to very quickly and adequately stop that kind of a bleeding. But most physicians feel that hemostasis is not necessary after a SpiraBrush sample. As a laboratorian, the sample that results from a SpiraBrush is quite different than the cervical sample that results from a punch biopsy. The laboratorian will receive the SpiraBrush, specifically the head of the SpiraBrush, decapitated into fixative solution. When received in the laboratory, the SpiraBrush needs to be handled differently than a biopsy specimen. In most laboratories, the procedure for handling the SpiraBrush is to straighten out the spiral into a long segment and then scrape downwardly with a pair of forceps onto a filter paper. The tissue that accumulates in a SpiraBrush is actually quite easily brushed down towards the tip of the SpiraBrush and results in a bead of mucus and tissue that can easily be packaged and placed into a tea bag into a cassette for routine processing. Although some care should be taken to ensure that all of the bits of epithelium that are present in the sample are accumulated, a laboratory technician can learn the procedure in a matter of a couple of samples, and there is a very, very steep learning curve. In the laboratory, the sample, once processed, should be processed exactly like an endocervical curating sample. As such, we would all like to see several levels of the sample cut onto a slide. In our laboratory, we process the sample, and we usually can fit 3 different levels onto one slide. The samples are small enough so that you can actually take 2 sections from each level and place them sequentially on the slide. So we can usually evaluate 2 sections from each level for 3 different levels per slide. SpiraBrush samples are very similar to endocervical curating samples, and as such can yield very diagnostic material. There should be an effort by the pathologist to realize that these are cervical biopsies and not endocervical curatings. The language that we use in our laboratory is equivalent to the language that we would use for a cervical biopsy. So we attempt to make diagnoses of CIN and be specific in all instances. We try to be as definitive as possible while maintaining diagnostic certainty. In some instances, special stains can be helpful, while in others, the morphology alone is sufficient.